So what do we know about sarcoidosis? Unfortunately, sarcoidosis is an uncommon condition that, quite frankly, I believe, although not everybody would agree, I think many people would, that because it's a one, uncommon condition, and two, has traditionally affected African Americans in a greater preponderance, it has not been a condition that has had nearly enough resources and time and energy put into investigating it. So this is what is known, which isn't a lot. So about depression and sarcoidosis. So one thing you can see here is that essentially doesn't matter what your age is, and it doesn't matter what your sex is, whether you're male or female, you have about the same risk of having depression across the age range. So it's an equal opportunity offender, depression is. It is very democratic in that sense. Age and gender don't matter. And that's different because in our general population, women are twice as likely to have depression as are men. So this is already telling you that this is a biology going on here. This isn't just some other phenomenon. The predictors are if you have pulmonary sarcoidosis involving the lungs, then the more difficulty you have with breathing. And if you have additional disease on top of sarcoidosis, those increase your risk of depression. This is a study that came out of Hopkins. And basically they found that there was roughly 40 to 60% of people had some, in the sarcoidosis clinic, had some degree of depression. But what was interesting is that if you looked at hospitalizations in the past year, there was no difference between the severity. This is increasing severity of depression. But the higher your depression, the more likely you were to go to the emergency room. And the presumption is that, people who are depressed, they tend to not take as good care of themselves. They smoke even if they have, pulmonary symptoms and stuff, and they don't exercise. And they also think, when something happens, it's like the sky's falling and the like. So that's just something to keep in mind. So there are lots of causes, anything that affects the brain, either directly through a stroke. This is cerebrovascular accident, Parkinson's disease, Alzheimer's disease, MS that I spent most of my time studying at Hopkins is the Michael Phelps. It has 50% on average chance of getting a clinical depression. But sarcoidosis is really, hanging up there too. It's not far off from MS. Oh my goodness. And so it really is just like these other conditions that affect the brain. It has high rates of depression. What do we know about MS? Well, MS is much more common. It's been around, well researched. MS is more like 1 in 500 people, 1 in 300 women, 1 in maybe 500-600 men. Now we understand it's probably the rate of ADHD. I mean, in some people. So in any case, we know that depression correlates with quality of life for people with MS. It also, depression is the #1 correlate of quality of life for their family. We know it has significant morbidity, meaning it affects people's function and mortality. Suicide is 7 times more common in people with MS, and 10% of people with MS will actually attempt suicide. 30% will have thoughts of it. So it is a lethal part of the illness. MS causes depression. We know that it's due to overactivation of the immune system. If you block the immune system, you actually have antidepressant effects because it's the immune system and all of the inflammation that goes on that causes it. It's not due to weakness or a personality flaw. It doesn't correlate with disability or gender. It's not, gee, you'd be depressed too if you were in a wheelchair, because it doesn't matter if you're upright and walking or in a wheelchair. It matters how much inflammation is going on. Depression also worsens MS. So MS causes the depression, but the depression makes the immune system more out of control. And in fact, treating the depression improves the MS. So it's a two-way street. And the other thing to keep in mind, and this is, again, probably applies much of this to sarcoidosis, just that we've studied MS more because it's one of the more common autoimmune diseases. So depression is treatable in MS, and you can restore people back 100% to their old selves if you give them the proper treatment. Talk therapy and antidepressants are often needed. So this just shows that one of the things about depression, why is it that depression worsens MS? Well, it turns out the thing about depression that we know is people with depression have elevated cortisol levels. And people say, oh, well, cortisol is the stress hormone. I don't think of cortisol as the stress hormone because nobody goes to the pharmacy and says, I need some prednisone because I'm stressed. They go because they say, I need some prednisone because it's an anti-inflammatory and it's the brake of the immune system. So here's the problem. If you have elevated cortisol levels, this is the more depressed you are, the higher your levels of cortisol are all the time, you're basically riding your emergency brake while you're driving, which means you're going to wear it out. And now your immune system will not be able to quiet down when you pull that emergency brake because what's going on is it stopped listening. So here's what happens. Stress causes the release of these signaling molecules. Your cortisol goes up, glucocorticoid goes up. And now this brake of the immune system that was telling all of these immune cells to quiet down and just chill no longer can. So if you get infected with something, in the case of MS, Epstein-Barr virus is thought to trigger MS in some people by hiding and looking like myelin. That's what that virus does. And now if you get infected and you've been depressed, your immune system is going to be overactive and you won't be able to shut it down. Says, of course, your daddy loves you. He's on Prozac. He loves everybody. It didn't have to be the case, but it turns out that I wasn't so stupid by studying MS. A lot of people said, oh, you're going to study depression and MS, but that's not going to help us understand depression outside of MS. Well, it turns out now, this is 2020, that all of the antidepressants that we've studied all have anti-inflammatory effects, which means that we have been studying inflammation going on in our patients who don't have autoimmune diseases because it's not a coincidence that all of these antidepressants have anti-inflammatory properties. And there was a study that came out last year that showed, in fact, 60% or more people who have depression without an autoimmune disease have smoldering elevated levels of inflammation.